Intermittent catheters are narrow tubes which are passed into the bladder via the urethra, and they're used to drain the bladder by people who can't empty their bladder themselves, and they often need to use it around 4 or more times per day to do so. And we think there are about 60,000 users in the UK. At the moment, the only type of catheter that you get is a single-use disposable catheter that you have to throw away after every use. Now, this hasn't always been the case. About 30 years ago, we reused catheters commonly, and people used to clean them between uses. Thinking about waste, this is the kind of amount that people who use intermittent catheters would need to use in a month. So that's more than 100. So if people could use reusable catheters for at least some of those catheterizations, then that would be a much more sustainable way of managing their bladder. In our Multi Cath project, we want to find out if users of intermittent catheters want to try and use reusable catheters, and also we wanted to find out if they're as safe to use as just using single-use catheters on their own. This is a reusable catheter. And it's the one that we use in the trial, and it comes as its own protective storage container. They're cleaned between use using just soap and water and then soaking for 15 minutes in Milton. What we found out so far is that lots of people want to use reusable catheters, and we have many people on our trial. We've recruited more than 500 participants, and the trial will be finishing next year. We also know that the reusable catheter that we're using in the trial is not for everyone, and some people find it not as good as the single-use catheters that they're using. And this is because we really need to introduce much better modern technologies into a reusable catheter. For example, new materials or new engineering techniques. And of course, in a reusable catheter, you can make that catheter more expensive than a single-use disposable one. So there's plenty of scope for doing this. The challenge really for the NHS is to make these catheters available to people so people can actually choose to reuse.